5 in the afternoon here on 90.3 FM. And you're listening to Helping Seniors of Brevard, the Wednesday edition. And we're looking forward to having Kerry Fink, the host of the show, join us here in just a moment. Kerry, how are you?
I'm doing good, John. How are you doing today?
You got me okay here?
Yeah, no
okay.
problems.
All right.
All good.
Good.
We're looking forward to a good day today. On behalf of Joe Steckler, our president and founder, and Kim Bernard, our executive specialist, welcome to the Wednesday edition of the Helping Seniors radio show. We got lots of good things on tap for today, so we hope you're enjoying a great lunch hour together with us, and you'll be able to have some really good information. At first, when Dr. Lee Sheldon sent over the topic for today, I thought we were going to have to sharpen our pencils and get ready for a math quiz, because the title of the program that he wants to talk about today is calculus. And then I realized, no, not that kind of calculus. He's talking about the root of periodontal disease. So we're going to be looking into that with Dr. Lee Sheldon here shortly. But also in the studio today with us is another longtime friend of the Helping Seniors organization. She is a registered nurse and really a wealth of knowledge when it comes to all the things we're going to talk about today. And in particular, what we're going to try to talk about with Traci Graf of Avid Home Care. Hey, Traci, how are you?
Hi, Kerry. Good. How are you?
Good. I was just thinking, you have a great article, which I can't even begin to pronounce the title of, let alone all that it is, but it's in this month's edition of the Senior Scene magazine in the Helping Seniors newsletter, which, as you know, when you get your free copy of Senior Scene magazine, there is the yellow pages in the center of it, and that's where we all work all month to try to get together information that is going to be helpful. And you actually did a full-page article, actually, in this month's magazine called Lymphedema and Decompressing the Problem. And this is the kind of information that you're able to help us with, because you understand this from the point of a registered nurse.
Yeah, I think I like writing the articles. I think that it gives me the chance to share a lot of the knowledge that I do have or that I've acquired as a nurse.
Yeah.
It's helpful to different people all over the place, but doing home health care, lymphedema seemed to be a huge problem in this area. There really are not many skilled nursing home care agencies that can do the type of maintenance treatment that's needed for that. So patients usually have to do a combination of treatments. Mm-hmm. They usually have to go outpatient for some of it.
Right.
Some of it they can do in the home. But typically I just try to pick a subject each month that I think will just be some random knowledge for people or things that I saw that were prevalent when I was working as a home care nurse.
Yeah, and I know as we get into our topic for today, which is going to be hip fractures in elderly, that's going to be an important thing for us to cover a little bit. And, that's the whole point of what we try to do on the Helping Seniors network of information. As you know, Joe Steckler, for years and years and years, you can pull out the Hometown News, you can pull out Senior Scene Magazine, Aldea Today, Ebony News Today. You'll find Joe's articles in there. He's always advocating for seniors, and he's always advocating about the idea that we need to create an aging plan so that we prepare for some of the things we might bounce into as we go along. Very much the same way we create a hurricane plan, right? If they tell us we have a hurricane coming to Florida, we don't want it, but we sort of get in mind how we're going to react to it. And that's the way I think we want to go to some of these things that we're talking about today. But before we jump into actually to the full topic of the program, let me give you a heads up on some things that are going on this weekend so that you can put these down on your calendar and be set with some good things to do this weekend. So what's going on at the tail end of this week, it actually starts tomorrow and then goes Friday, Saturday, and Sunday, is the they call it the Florida Vietnam and All Veterans Reunion, and that's taking place over at Wickham Park. And they were telling me, I was talking with John Frederickson, who's the publisher of the Senior Scene magazine, and he was telling me they get up to 70,000 people who are going to show up over this weekend. So there will be a booth with Helping Seniors and Senior Scene, so you can go run by and get your Senior Scene magazine. We'll also have car raffle tickets and information about the car raffle. I think we'll probably have information about the Helping Seniors cruise out there. But I think generally throughout the day, you're going to find somebody manning that booth. And I hope you'll go by, support our veterans. I mean, they make it possible for us to live free. And I think it's a great event. They have that moving Veterans Memorial Wall that they bring in, and it's apparently quite a touching display, but also a nice afternoon in the park. So, and I think they have music, entertainment, all sorts of things. So again, that's happening at Wickham Park. John Frederickson said they're going to set up about 11 a.m. tomorrow, Thursday. So they'll be there throughout the day, Thursday, Friday, Saturday, and Sunday. So that's a great place to go out for this weekend. And then also on Sunday, this is another fun event that's scheduled for Sunday, and we're actually going to pull a couple of the Helping Seniors raffle cars out for this one. It's going to be at the Melbourne Auditorium. Now, they're not actually going to be inside the Melbourne Auditorium. They're going to be out in the the parking lot, and then that beautiful park area that's next to it. They're going to kind of spread out, and they're having what they call the Space Coast Fun Fest. So it's going to be just a nice day in the park. Everybody safe social distancing, but getting outside and enjoying the sunshine and everything like that. So it's going to be a nice day from 10 a.m. to 4 p.m. They're going to be out there. It's free to show up and have a good time out there at the Melbourne Auditorium. Kim Bernard, our education specialist, and Chris Morse, who heads up the Helping Seniors Travel Club, they are both going to be there. And so it's going to be a good day to be out there. I think Kim is going to bring out the Kia Sportage, which is one of the 4 cars you can win in the Helping Seniors car raffle. And then Chris, I think, is going to be tooling down the road in that very cool 2021 Dodge Challenger. So you can see both of those Helping Seniors raffle cars. So again, that is going to be this Sunday, 10 a.m. to 4 p.m. at the Space Coast, it's called the Space Coast Fun Fest, and it's going to be at the Melbourne, the grounds of the Melbourne Auditorium. So a couple of great things to put on your calendar for this weekend. Get out there. It's a great chance for you to help support the work of Helping Seniors by getting your Helping Seniors car raffle tickets. Check out these great cars and support the work that Joe Steckler started 10 years ago. Okay, it's hard to imagine that we're now actually moving through our 10th year of service to this community. So thank you for supporting the work of Helping Seniors. We can't do this without you. And now, I think I understand that we have none other than our expert mathematician, and that's Dr. Lee Sheldon. Hey, Dr. Sheldon, how are you?
Expert what?
Well, mathematician, you called this show Calculus, right?
Oh, my goodness.
Wow.
I should have gotten that myself, Kerry. My goodness, you caught me.
Well, I was never good at math, so I'm so glad that you are good at periodontal treatment and explain to us about calculus and how important this. You actually titled this "The Root of Periodontal Disease." And so, folks, I'm talking with Dr. Lee Sheldon, noted area periodontist. He has a tremendous practice. He's been a friend of Helping Seniors going back well before there was a Helping Seniors. In fact, the story goes that Dr. Lee Sheldon introduced Joe Steckler, our president and founder, to the world of television through your own television show that you had back in the day.
That's right. The name of the show was Checkup. It was at that time. It was on Time Warner Cable, what is now Spectrum. And it was they had a studio just in that building, just south of Kelly Ford. And we would do that show for every week, and that was on for 8.5 years.
And so you created Joe Steckler, the television star, who really, over the years between Brevard Alzheimer's, the work that he did establish, they still call them Joe's Clubs to this day. And then now for 10 years with Helping Seniors and making sure that the county has its own senior information helpline. And just think, you got him rolling with that part of it anyway.
Yeah, and actually, Joe's a natural, as you know.
Yeah. Oh, absolutely, absolutely. He did. I have to brag on Joe because we, for the first time as an organization, and folks, you think nonprofits get a lot of help from all these government entities, and it's just easy. And no, it's a day-to-day fight. But listen, for the first time in 10 years, we were at the Brevard County Commission and we were competing again for a grant that was geared to that was coming down the pike. And so Joe got up and gave a tremendous presentation to the board that was making the decision about these things. And, you know, I commented to him, it was a great presentation because he said, Kerry, and he said to the board, it's all about helping people. We got to be helping people. And so I said, by the time you finished telling that story, and here you are, 87-year-old retired Navy captain, you don't take any pay for any of this, you just volunteer your time. I said, how could they not fund you? And so they did, and it was really heartwarming. But you're right, Joe is a natural at that.
Yeah.
So today in the studio,
that was when we were all a little bit younger,
and we take a knocking and we keep on rocking.
And
so
we're all plugging away, aren't we?
That's it. So we haven't.
You weren't in Brevard County yet, Gary.
Well, we've had a home here since 1997. Although the story that Tammy and I tell is we've really only been full-time New Yorkers, I think, since about 2008. But I mean, that's been a few years now.
It has.
Yeah. Well, yeah.
So yeah, that show that Joe and I did together a few times, that was on from 91 through 99. So
wow. so
that's when Joe and I first met,
wow.
And you know, it was a nice show. It for a while it was produced by, at that time before Health First, it was produced by Holmes Regional Medical Center. And it gave me a big opportunity because I like to do public speaking.
Yeah.
But when you're sitting in front of a camera every week and learning how to interview and trying to figure out which camera to talk to, the camera itself would suck the life out of you. And it did for a few years, but it essentially gave me a lot of abilities that I wouldn't have had otherwise. So to me, even though it was a volunteer job, nobody got paid anything. But what an opportunity to just be able to sit in front of a camera. I don't know how many people watch, but to be able to sit in front of a camera or three cameras, knowing which light to look at, and be able to interview people at the same time, it was very good.
Yeah.
And I credit that experience to some of what people think I have as better public speaking ability. So it was great.
Yeah, and I got to tell you, folks, our other guest in the studio today, we have Dr. Lee Sheldon with Solid Bite Dental. He has a very well-noted periodontal practice, and also with his son together, Matt Sheldon, one of the top 40 dentists under 40, he was named. And so you guys are really pretty much equipped to handle pretty much anything there. But also in the studio today, we have Traci Graf with Avid Home Care. She's a registered nurse and a real expert on things. So we got a lot of stuff we're going to get to today. So maybe what we should dive right into is not math, but calculus, the root of the periodontal disease. And
let's look at calculus. Calculus is making a big comeback as a result of a paper by Dr. Charles Cobb and Dr. John Sottosanti, two well-known researchers who came out with a paper in the Journal of Periodontology. In fact, I don't think it's been published yet, but it's been accepted for publication. And essentially what they found is, calculus is tartar. And there's two different kinds of tartar. One is the one that grows above the gum line. That's a cosmetic type of tartar. You usually find that in front of behind your lower front teeth. And then there's the calculus, which is below the gum line, and that's the one that's associated with periodontal disease. And so they did some new testing on calculus, and there were two new findings, some findings that we expected, but they were never proven before. One, which was important, is that when a hygienist cleans off calculus, the calculus actually breaks off the root surface.
Wow.
So the calculus usually isn't removed completely unless there's fantastic efforts to be able to get the calculus off. So you know how you're scraping
right,
and the calculus comes off? Well, the calculus breaks away from itself, and there is calculus that's remaining on the root surface, and the binding strength between the calculus and the root surface is greater than the binding strength between the calculus and itself.
Wow.
That becomes a big deal, because people get scaling and root planing done for periodontal disease. And I think that one of the quotes in the article, and I don't have the quote in front of me, was that people who are skilled in this profession, meaning periodontists or most periodontists, understand that scaling and root planing, or removal of calculus, is a lot more difficult than it seems. Now we're proving that, in fact, it really is a lot more difficult because of these studies, I think it was fractographic studies or something like that showed the way calculus breaks off. So imagine you clean calculus off, and you've got fractured calculus under the gum line.
Wow.
People say, "All right, I've had a deep cleaning done. My pockets don't get better." Well, this may be very well maybe one of the reasons why the pockets don't get better, because all the calculus isn't removed.
Wow.
We may smooth it off, but we may not remove it entirely. In fact, there's a good chance that we won't remove it entirely. It goes back. I mean, this is retrospective bragging, if you will. 20 years ago, we bought the Perioscope, a camera, so that we could see the calculus below the gum line, and we could see that we're getting it off. This kind of proves that you've got to be able to see what you're doing in order to be able to get this calculus off. The second thing that was shown was that when the calculus breaks off, the calculus has little depressions within it. In other words, it isn't solid. The surface of it, when it breaks off, very much looks like the surface of the moon with little craters in it. Yeah. And there's bacteria located within those craters. So you break off the calculus, and now you've got these open areas of bacteria that are just harbored within the middle of the calculus.
Wow.
And of course, bacteria and calculus are what causes periodontal disease in the first place. So this is making big, and when it's published, first of all, the periodontists know about it, at least the periodontists that communicate on a certain blog that I'm in. They're in on it, they know it, and when this goes public, I think there's going to be a big concern within the profession. Am I really removing all the calculus, and is my periodontal disease really under control as well as it could be?
Wow. That was something I wanted to ask you about, because, when we go for our regular teeth cleaning checkup, you're talking about something that's quite different than that, or is the cleaning part of that whole process of attacking the calculus?
I am. Of course, in a regular checkup with no disease, you really don't have anything to worry about. I'm not worried about that part.
Okay.
It's when you have disease and we're trying to clean that stuff off, and if we don't get it off completely, then we have continuation of the disease, and if the disease continues long enough, we've talked about this on a number of occasions, is that the pocket will get deeper, and the tooth will eventually loosen and come out.
Wow. So there's all these terms that we keep hearing: cleaning, scaling, root planing. I guess the latter two have more to do with trying to attack this issue of calculus, right?
Yeah, you're right. I mean, if we're talking about cleaning, we're talking about cleaning. It's usually something. If you don't have any disease, there's no reason to go below the gum line and clean. I mean, you go to the gum line, but if there's no disease, there's no disease. I mean, it's primarily a cosmetic thing. We remove the plaque, we remove the stain, and we're done, and that's good. If you start to develop some calculus below the gum line, that means that there's going to be a break between the attachment of the gum tissue to the tooth, and that is where the infection begins. And so the hygienist wants to go in there and get all of that cleaned off, and that's the desire of every hygienist, is to get that stuff completely off. But then when you get into areas that measure 5 millimeters or more, then you're getting into serious areas where the hygienist can't feel it very well, and now we've gotten one more indication that we're breaking off calculus, and if the hygienist can't feel it, that may be the reason why, and we know the calculus is attached to the root really strongly. That may be the reason why the pockets continue.
Mm-hmm. So when this is happening, how do you, as a person, know where you stand on this scale? How do you know if this is a problem for you or not?
I think when you're in the dental office, I think it's important that a periodontal probing examination be done on every patient.
Uh-huh.
And when that periodontal probing examination is done, which is essentially placing a probe or measuring device between the gum tissue and the root, and you put the probe down until something stops you, and that's an attachment between the gum and the tooth. and you get a chart, and you see how that's doing. So you should have a chart of 6 readings on each tooth, so you know what your pocket depths are on each of those teeth.
Okay. So that's
at least once a year, that pocket probing should be done.
Mm-hmm.
And if you see things are getting better or staying the same, I think you're in pretty good shape.
Mm-hmm.
And if the numbers are getting worse, then it means that the periodontal disease is getting worse. That means there's more bone loss on the tooth, and then it's time to be a little bit more aggressive in getting this handled, so that you get to keep your teeth.
Now, if somebody goes to just an average checkup cleaning, and they're just out there and they're going wherever they're going, is there a difference between what's going on with a dental hygienist there and, let's say, a dental hygienist like would be in your office as a periodontist office?
Well, I can tell you this. All hygienists are trained for 2 years, sometimes longer if they're going for a bachelor's.
Mm-hmm.
But they're trained in the clinic for 2 years. All hygienists get equivalent education.
Mm-hmm.
As in any profession, you're going to have people who are better and people who are not as good, and we all know that's given. I think once you go, if you have a hygienist who's working in a periodontist office,
mm-hmm.
then the hygienist has a higher bar to get over than sometimes than a general dentist. I'm not saying the hygienist is bad or the general dentist is bad. I'm not saying that at all. But if I'm used to looking at gum disease every day, and I have this calculus brain on me with a probe where I'm feeling for calculus when I go below the gum line, I'm not just probing below the gum line. And if I see something that looks a little bit weird and I ask for a scaler, then the hygienist feels awfully bad that she didn't remove it and I was able to. I got to tell you, one of the biggest, you know Rebecca, right? Rebecca?
Yeah, sure.
Okay. So I'll tell you, Rebecca doesn't mind telling the story. So Rebecca's been with me for, 38 years?
Dr. Sheldon, if this is like more than 30 seconds, we're going to continue it on the other side of the break. But I do want to cover that story. So if it's all right with you, we're going to hear the Rebecca story, because this is important, what we're talking about. This could literally save your teeth. So we're going to be right back on the other half of the break with the rest of Helping Seniors Radio.
Now here on 90.3 FM, you're listening to Helping Seniors of Brevard for this Wednesday afternoon. Helping Seniors heard every Wednesday, 12 noon to 1 o'clock, exclusively here on 90.3 FM. Right now, let's get back to more of the show, and here's your host, Kerry Fink.
Thank you, John Harper. And on behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, we are mid-conversation with none other than Dr. Lee Sheldon, noted area periodontist. And if you remember, just before the break, we were talking about how important it is to try to get down. We're talking about calculus, the root of periodontal disease, and how important it is to get down below the gum line. And so Dr. Lee Sheldon was starting to tell a story about, as a periodontist, when he comes in to check the work, and see how things are going. And, this whole issue that you're explaining about calculus sometimes breaking off below the gum line, this is a whole interesting thing. And you were starting to recount this really interesting story about what happens when you discover that.
So Rebecca's been working for me since 1984. She had worked for another dentist for a very short period of time before she started working for me. So she does her thing and does her cleanings, and of course I'm training her along the way because that's part of what I do. If we're going to get periodontal disease taken care of, that's very much dependent upon the hygienist. When she does her work, then I go in and I check, and at that time, it would never happen now, but at that time I was finding calculus below the gum line.
Huh.
And so I'd ask her for the particular curette, and I'd remove the calculus, and she'd accept it and go on. At 6 weeks that Rebecca had been working for me, and this is not the only hygienist where this has occurred, but Rebecca's the example I can talk about. she comes crying into my office. She says, "I've been leaving calculus on teeth. I've been hurting my patients for this length of period of time," which essentially was while she was in hygiene school, because it wasn't caught there, and then
No.
she was working for the general dentist. And she was feeling so bad for her patients. What am I going to do? How am I going to get trained? What? And she was just totally frustrated. You know what? That's the hygienist I want.
Yeah, somebody who actually
I want
cares.
the hygienist who understands what she does know and what she doesn't know.
Wow. And
so Rebecca has to be one of the top hygienists in the country. We got the periscope, the tiny camera that goes below the gum line. We got that in the year 2000, and she mastered it. She worked hard, Kerry.
yeah.
I mean, imagine you're taking a camera, putting it below the gum line. The camera's the same size as a periodontal probe. You put it down below the gum line. You're magnifying the root 40 times, and you've got to get that root clean. And there's a camera where she can inspect it and see how clean the root is.
Wow.
She worked, and she wanted extra time, and we schedule a certain amount of time for patients, and obviously it's a business, and so time is money and all that type of stuff. No. I gave Rebecca as much time, and I always would do that anyway. Gave her as much time as she needed. She needed extra time, whatever it was. You didn't charge a patient anymore. You just do what needs to be done.
Yeah.
Now, that scope, by comparison with today's scope showed detail. That scope showed shadows, and you could interpret what the shadows were, and she just got it, and she got it beautifully, but she worked and worked and worked and worked hard at it. So when you see a new paper that just came out, and it shows what we kind of intuitively knew, but now it proves it, it just goes to show how hard it is to really get a root scaled, which means remove all calculus, and then planed to smooth that root surface off so it doesn't have nooks and crannies the bacteria can get into. It's a tough job. I couldn't do it. I really couldn't do what she does.
Wow.
So it's hard work. It's hard work, and the fact that she cried, and I can't tell you how many hygienists have cried in my office, and some didn't make it.
Yeah.
They couldn't do it, and those who made it did. But it's not an easy job at all.
No, that's what it sounds like. It sounds like there was a quote that we were talking about. What's the difference between somebody saying that's the best that can be done and that's the best that I can do? I mean, it does seem like it takes a lot of skill and attention to do this the right way. Yeah,
that's very frustrating for me, because if the patient is seen and isn't seen by a periodontist, and the assumption is just made, oh, you have to have your teeth extracted, or you watch a commercial on TV and get the teeth extracted and put in dental implants because nothing can be done. If you have periodontal disease and you're told that, and you haven't been referred to a periodontist who confirms that nothing can be done, then you haven't taken it far enough. You've got to see a periodontist. You cannot assume that if it's not controlled in the general dental office, that nothing can be done. I mean, there's got to be a reason that we go to school for 3 years longer after dental school. Maybe there's something that we know that can help patients. There are a lot of people we've talked about this, who've been told they had needed all their teeth out, and we see them and they have their teeth 30 years later. It's more commonplace than you would think.
Yeah, and we've talked about this a lot, and that's why I want to give you an opportunity to share the phone number and such, but I want to state this first. You can have the benefit of really getting a correct view of what's going on with all this from Dr. Lee Sheldon's office, because you have a new patient setup that is actually helps us as a fundraiser for the Helping Seniors radio network. And we're gonna move on, and we're gonna talk about hip fractures here in a moment, but I want to make sure that we leave people with an understanding that they really ought to check this out, because I think what you're really talking about at the end of the day is saving teeth.
Yeah, I mean, we do a lot of dental implants. We're known for dental implants, of course. By the way, one reason I'm known for dental implants is because Rebecca was so good at periodontal disease, I needed to do something. So I had to learn how to do dental implants and bone grafts and all that kind of stuff. But Yeah, I mean, the special is very simple. Write a check for $50 to Helping Seniors of Brevard County and get the x-rays, the CT scan, the full examination, an entire 2-hour experience for no charge at all.
And how do folks get in touch with your office?
Oh, just give us a call at 259-8000, 321-259-8000. Tell them you're donating to Helping Seniors of Brevard, and Jennifer will get you all set up.
Yeah, and this is a great deal because as I understand, this isn't let's just look at your smile and tell you. I mean, you guys do everything. You do like the CT scan. I mean, it's like a full visit, and you know exactly where you stand.
Yeah, I mean, it's neat because my son's there. He's a restorative dentist. I got Michelle Furtado, who's a board-certified periodontist. And the two of them work great together. They'll be on the lecture circuit once we get back to normalcy here. The work they're doing, I'm so proud. I mean, at this stage of my career, to be able to have the two of them working together and doing such a tremendous job on people, it's just really neat.
No, it's a great office. Well, one more time, let's pass along the number so somebody can take advantage of it. Because listen, when you do that, you're doing yourself a big favor, but you're also helping us in helping seniors. But probably the most important thing that's going to happen here is you're really going to get the benefit of an expert. I think that's so important in this. So how do we get in touch with you?
So just call Jennifer at 321-259-8000. And say you want the full examination and you're donating to Helping Seniors, and Jennifer will get the whole thing set up.
Like the whole sound of that. And again, thank you, Dr. Sheldon. I want to remind you, listener, that there are a wealth of resources on the Helping Seniors website, TV shows that Joe has done with Dr. Sheldon, that I've done with Dr. Sheldon. All the radio shows are archived, lots of great material. So thank you for always sharing with us here on the Helping Seniors radio show, Dr. Sheldon.
Great to talk with you, Kerry. We'll talk again next month.
All right. Sounds great. Thanks. And so as we move along, we're going to talk a little bit with Traci Graf, who is not only a registered nurse, but she is you're the leader of the group called Avid Home Care, and you guys are like really experts at home care. And I know we've relied on your expertise as we've gone through COVID, because you've been in emergency rooms, you've been in psychiatric health care. Your career has just spanned so much of this. And today's topic that we're going to talk about, I was reading these statistics during our mid-show break. 300,000 people over the age of 65 experience a hip fracture
every year. That's the estimate.
That's every year?
Every year.
And
95% of them are from a fall, of course.
Wow.
Yes, I was rather shocked. So that's the subject for my May article, and I worked in the OR for a lot of years. I mean, I scrubbed with the surgeons, and we did all the different types of hip fractures.
Right.
And I worked in Philadelphia, so we had a lot of snow on the ground. And one of my favorite surgeons used to call it white gold.
Oh.
And we would all make a lot of extra money when there was snow. But I was a little shocked by some of the statistics that I found when I went doing my research for this article. And I mean, there are a few studies out there that look at how recovery goes for a lot of these people, and I found it interesting. And it does tie in with being a home care nurse as well for me, especially.
Right.
I'm all about prevention, and every patient I've ever had that fell always says the same thing. It happens so fast.
Oh yeah.
And that's what it does happen fast. And we know as nurses going into the homes that a little bit of prevention can go a long way.
Yeah.
Because let's face it, when you're over the age of, I would say 75, a fall with a hip fracture could severely change your quality of life.
Yeah, I was reading a statistic that you've got. Again, this is your article that's going to be appearing in the May edition of the Helping Seniors newsletter. But it's like they talk about the mortality rates. 80% return to previous level of functioning, but studies show a 1-year mortality rate connected with that. And so
at 21%.
Yeah, so this is not something to fool around with.
No, it's definitely not. And, I also found it interesting. Another study that I quote in the paper is that they looked at people who over the age of 90, which in all fairness, that's getting definitely up there in age.
Right.
Although I have a lot of patients and clients here in Florida who are 90 and above.
Wow.
And they're healthy and independent.
Wow.
But I look at them and I know that one fall could completely change that for them.
Yeah.
And they were quoted a study of 41% of patients over the age of 90 who went for intensive rehab to recover. Mm-hmm. Really, only 41% of them recovered to their previous level of functioning.
Wow.
So, I've also found it very interesting that the biggest risk factor that I could find is being female.
So this is more of a problem for ladies?
70%
Wow.
of the hip fractures every year are in females.
Wow.
I was very shocked by that. Being a female, I was like, really? I realize that we do have more osteoporosis a lot of times than males. And that is definitely one of the factors that can lead to having a hip fracture. But some of the other things, falls, obviously, some of the medications that people use, especially for COPD, can cause the bones to be weakened.
Oh.
But again, that's not more prevalent in females than it is in males,
right,
COPD.
Right.
But something, I guess maybe our pelvis is smaller. There isn't really clear why, other than the osteoporosis factor, why that is. So, I find it interesting in where the fractures are. They said 90% of all hip fractures happen up in the femoral head or neck area.
Okay, which for a non, I barely know where.
That's the ball.
Okay, I'm
the
with
ball.
you. Okay,
the ball that goes into the socket.
Okay.
Most of them have the fracture up around the ball of the femur.
Wow.
So, and that is the one that can sometimes be limb threatening.
Oh.
Because the way that sometimes the bones go when they fracture up in that area, they can cut off blood supply.
Oh no.
To the leg.
Oh no.
And if that happens, that is a serious surgical emergency. That hip fracture needs to be fixed today.
Wow.
To restore blood flow to the leg. So, they and I will tell you, I have had many patients as a home care nurse who I have encountered walking around on hip fractures. I just went to see a client of ours 2 weeks ago, literally 2 days after I submitted this article. And I walked in, and the first thing I did was pull the sheets off of her feet. I knew she had had a fall, flat down on her behind in the bathroom. They had picked her up. She was walking on it. She was having pain, but she was walking. When I looked at her feet, not only was the right foot 2 inches shorter than the left, but it was also turned out to the side. And I was like, oh, those are two absolute textbook
things to look
things
for.
That's a hip fracture. There's no doubt that's what that is.
Wow.
And we called the paramedics and off she went, and she actually had more than just a hip fracture, but
oh my goodness,
she had a fracture in her distal femur, which is lower down on the large bone of the thigh, where she had a total knee implant that was loose. So I'm not even sure, she's in rehab somewhere.
Wow.
But we take care of so many of these people with these types of fractures, and depending upon how the surgeon chooses to fix them, usually we see them recover if they choose to do something that's sort of like a total hip replacement, which a lot of them will if it's up around the ball or the neck. That tends to get people up and moving a lot faster than if they do a plate and screws, or a more popular way for the farther down on the shaft of the femur is to use a rod. So they do that a lot as well. But, I think that we find people with all different types of, fracture repair. Some of them, they choose not to repair them. And they just, depending upon their age and their medical condition, and they choose to do non-weight bearing for a period of time and hope that it heals.
Wow. There was many years ago, Joe was working with an expert who is he's an expert in physical therapy, and they did a show, and it actually is one of the most popular shows all these years later in terms of total number of views, and it was called Balance and Falls, and it was from a guy, his name is Chris Marriott, and he's like a physical therapist. Really did an excellent job of explaining the importance of not falling and giving some real good advice and direction on things that you might consider to do that. So it seems like and by the way, folks, all these shows, just like we were talking about with Dr. Lee Sheldon a few minutes ago, and Traci, we've done a number of Helping Seniors TV shows on a variety of topics as well. So not only are they broadcast on Space Coast Government TV 3 times a day, Monday through Friday, but they're also available on demand. You can find them either at helpingseniorsofbrevard.org. If you like YouTube, you can find subscribe to our YouTube channel there. You can just search things out by topic. They're also on Facebook, so you can if you just like Facebook, you can find them there. But I guess step one is prevention, and in that, how do you help when you go into a senior's home? Because you guys are like the hands and eyes and everything when you go into a senior's home. How do you help them on the prevention side of this?
Well, it's hard sometimes because with Avid Home Care, we're what's considered a non-skilled agency.
Okay.
And I've worked in both home care worlds, skilled and non-skilled. So my skilled nursing brain says when I walk into a patient's home, because I'm the owner, but I go out and do all my own admissions as well.
Right.
I enjoy that connection with the client. I enjoy the assessment and helping them and matching them up with a great caregiver because I've met them and I know my staff.
Right.
So I've become pretty good at matchmaking as well. But typically, we see the typical things: throw rugs, cords, pets, oxygen tubings. Those kind of things are the typical fall risk type areas you see. Maybe a step. A lot of people in Florida have like sunken living rooms, where they have these step down and step up. They're a disaster when it comes to fall preventions. But some of the things that I myself have seen too is people, they tend to walk away from their walkers, they walk away from their canes, they don't use them right. I don't know what to say except to them over and over again that it's only a matter of when you're going to fall, not if. And I met a lady the other day who fell at home and, of course, had a life alert but was not wearing it.
Oh, no.
And had to crawl in from her utility room.
Oh, no.
And, that's what happens. So, anyway, prevention, though, I do want to touch real quickly because a couple of things I read when I did this article that I had not thought of when I was a home care nurse for Medicare. And that was to have people get annual eye exams.
Oh.
I wear glasses and I'm guilty of it myself. I don't get an eye exam every year.
Yeah.
But, I thought that's actually really a smart thing to incorporate. If
makes sense.
You are a fall risk
and
or you have osteoporosis, you probably should, make sure your vitamin D level is correct. Make sure you're taking calcium. Make sure you're exercising even a little bit every day. The annual eye exam, definitely avoiding drinking. Alcohol will throw off your balance. Certain medications will throw off your balance. And smoking will weaken your bones as you're older. So, a lot of these things are beyond, like I said, just sort of removing throw rugs and moving obstacles. It's more about taking care of yourself.
Yeah, it's like you got to take the whole idea seriously, right?
Yeah, you really do, because when you reach a certain age, a fall could really be. When I meet someone who's 91, independent, living at home, she's doing pretty well on her own. Maybe needs help with a little bit here and there. But I look at her and I realize that one fall could be literally be the end of her life.
And you guys, I'm talking about your business, Avid Home Care. This is what you guys do. You go in and you provide a lot of services that probably, in a way, also keep the home safer too, right?
Yeah, definitely. And we're definitely different than some of the agencies that provide the same services. And one of the reasons is is because I have that skilled nursing
your
mindset.
background, right?
And I go in and do the first assessment.
Right.
So, with talking with the patient, the client, and talking with the family or whoever else is involved, and trying to set up what they need and what they want, I think that we are exceptionally good at customizing it to each client for what they need. And I'll just give one real quick example. We have a young lady who has worked with a patient or a client who has had stage 3 Alzheimer's for over a year. She has not had any progression. And some of it, the doctor actually believes that much of it is because of the strict routine that we have put her on with this young lady who goes every day for a certain period of time and does the exact same things with this lady every single day she goes in the same order. And the belief in that with people with Alzheimer's is that they only have so much memory in the tank. So by making them use their memory bank to do things like brush their teeth, get dressed, take a walk, you're making them use up the memory fuel they have. Do you see what I'm saying?
Yeah.
So by making it so that their lives are very routine and very regimented, it allows their memory to sort of be used for other things.
Right.
And that's a real thing with Alzheimer's patients.
Wow.
But this young lady has done a fantastic job with preventing progression of a terrible disease just by being regimented, dependable, and they're on a schedule that the lady can depend on.
Yeah, that is such an important part of this. And I know we've had this conversation, especially going through COVID and all the things that we've all been through, that, you guys have really had to even step up farther because maybe relatives that otherwise might have traveled in to see somebody can't get in and all those things. And so it kind of really stretches the demand for your services and the things that you guys do.
Definitely.
I do want to ask, if somebody does want to give you guys a call, how do they get in touch with you? I mean, how does the whole process work?
All they have to do is call the office. The number is 321-392-3400. Our office is in Merritt Island, but we do serve the entire county. If you call the office, you'll speak to either me or my son, who has become involved with us now for about a year, and his name is Jeff. And he can take care of you, schedule a admission visit or an assessment. We can answer questions, whatever it is that you need. We'd be glad to help.
That's good. So let's say that phone number again.
321-392-3400.
And this is for Traci Graf, who's a registered nurse, and she is the owner of the Avid Home Care Service. And really, I think you get the benefit of a couple of different things if you give you guys a call, right? You get not only the benefit of your wisdom, of your experience in all these broad areas of what you do to help people, and so that's like one benefit. You can see all those things, but also then you're able to match up the person with the kind of help that's going to be appropriate for what they're trying to do next. And just we've only got like a minute left, but hit a couple of things that people might give you a call for help with.
Lots of different things: grocery shopping, transportation. Not just things they need, maybe things they like to do. Go to the nail salon, go to the hair salon, go for a ride up at the beach, go for a walk. We've had clients who've wanted to go to the zoo.
Right.
The art fairs, the Cocoa Village Art Fair is a big one. So we have people who do use us on an as-needed basis. We have people that use us every day. We have people that use us 24/7 in their home. We're very flexible about customizing and making it very individual to whatever you need.
That's good.
And I find that really there is a huge benefit to me going out and meeting these clients. And I mean, we have 48 employees. So, we're not a small agency anymore.
Right.
And but I still enjoy the benefit of meeting each client and making that connection.
No, it's good. So one more time, the phone number for Traci Graf with Avid Home Care.
321-392-3400.
All right. Well, thank you for joining us today on the Helping Seniors radio program. Thanks also to Dr. Lee Sheldon for being here with us. So we will see you next week. On behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, thank you for joining us for Helping Seniors radio. Have a good week.